So what we talked about today in terms of COPD and understanding how to manage COPD are two aspects. There's the pharmacological and there's the non-pharmacological. And the pharmacological, we often get caught up in the 20-minute visit because we have to make sure that they're taking their medications. We have to make sure that they have their medications and they know how to use their medications. And so it's a draw. I mean, yeah, a lot of our time in the clinic visit, whether it's the primary care office or the pulmonologist office, is to make sure that they're using their medicines. And that can be a detriment only to the point where it excludes the non-pharmacological. Because if you look at the things that we can do for patients with COPD, the interventions that actually improve survival are non-pharmacological interventions. What are those things? Things like, for instance, smoking cessation. How much time are we leaving to talk to patients about the fact, are they still smoking, and what we can do to help them quit? Number two, oxygen. Do they need oxygen therapy? Are they on oxygen therapy? Are they using their oxygen? Studies have shown very clearly that patients who require oxygen and use oxygen appropriately actually have improved survival. And then the last one is pulmonary rehabilitation. There's been a number of studies that have looked at the use of pulmonary rehabilitation in gold stages of COPD from 2 to 4. That would be mild, moderate, that would be moderate, severe, and very severe. And it shows that, in fact, people who use and utilize pulmonary rehabilitation techniques can actually have improvement in quality of life. They can have improvement in terms of less COPD exacerbations and improved survival. So I think that pulmonary rehabilitation is really important in terms of adding these things into the guise of non-pharmacological interventions. And let's make sure that in our clinic visit that we're making time for those things because they actually have an impact on survival and giving the patients the care that they deserve.